Welcome to our Doctor Speak series at Nature Fit. And guess the podcast for today. It's about healthy spine. A healthy spine is foundation of a healthy life. And they say actually that you are as old as your spine health. So अगर हमारी spine health बहुत अच्छी है, so even if biologically we have aged, we can still feel very young. So today we will like to understand how physiotherapy can actually help us to maintain. One is to maintain our spine health, and even in the cases where we do have spine injuries or spinal cord issues, how can we recover with the help of, in a non-surgical way, with the help of physiotherapy? Today we have with us Dr. Smita Lodhe. She is the guest speaker for today. She is a physiotherapist, doctor in Navi Mumbai. She has 12 years experience in practicing physiotherapy. She has been rewarded as the best physiotherapist in 2015. She is a gold medalist in cupping therapy. She is a certified Mulligan therapist, MMT therapist, dry needling therapist, taping therapist, neurodynamics therapist, postgraduate in cupping therapy, antenatal and postnatal care therapist, fitness therapist, diet and nutritionist. So I think we have one in all kind of, so there are a lot. So that's, I think that's the beauty of these therapies, where there is a holistic approach. We have to take care of our diet, we have to take care of our exercise, we have to take care of, and somebody who is so knowledgeable in all the aspects can actually treat you in a perfect way. So she practices, McKinsey dry needling, advanced cupping, sport kinesio taping, Pilates, Swiss ball exercises. So, absolutely all the techniques which can keep us healthy and fit. She also has an advanced device which is called PEMF, Pulsed Electromagnetic Frequency Treatment. So that's something maybe ma'am will share with us. What is it all about? Today, moving to the topic for the day, spinal wellness with physiotherapy. So, a very warm welcome, Dr. Smita, to our podcast today. And we'll start by understanding what are the common causes and symptoms of spinal issues, and how can we actually handle it.
Thank you so much, ma'am, for welcoming me. It's my pleasure to serve to Nature Fit and to share my knowledge with all. So, to understand about the spine, let's understand what is spine. So, spine is made up with the bones, muscle, joints, and other tissues. And there are the five sections of spine: the cervical, thoracic, lumbar, sacrum, and the coccyx. Okay, only out of which only 24 hours 24 bones which are on the top, they are movable, and the rest of them are fused. So each has different role to play with our body. Basically, they hold our complete entire body, so that we can move our hand, move legs, move your neck, like that, and it supports our entire system. So now, to understand what are the causes because of which the back problem or the spine issues happens, is basically mostly the excessive weight and the obesity, improper lifting technique. Someone who is having the jaw profile like lifting, pushing, twisting, or turning like this. Then the nutrition and the lifestyle changes, like someone who is having the sedentary lifestyle, or those who are taking less of calcium intake, or someone who is a chronic smoker, uh, accidents or fall, or injuries like sports injuries, or gym injuries like poor posture, degenerative changes that comes from the wear and tear of joints, which comes with the aging. And then sometimes maybe because of the other conditions like OA, osteoarthritis, rheumatoid arthritis, or spondyloarthritis, like this. So sometimes it may be because of the congenital disorder, or infection of the spine, like tumors and all. So there are many causes, but we have to evaluate the cause of the patient, and then we need to treat them accordingly.
Right. So I think, even looking at the statistics, almost 15 to 20 lakh people are actually suffering from spinal cord injury in India. And definitely globally, that the number is much, much more. So I'm sure, there, these are, as you said, some of them are, the reasons are within us and we can actually take care of them. And some of the causes like accidents or injuries is something which we cannot, it's not in our control. So I think definitely we like to understand the ones which are in our control, how, going forward, that how we can, ensure that we do not face this kind of a spinal issue. So now going, next on the next question, when it comes to non-surgical management of spinal conditions. So this is where we want you to kind of, just highlight that how physiotherapy can actually help in a non-surgical way to take care of any of these spinal conditions.
So, when it comes to non-surgical way, there are multiple options available. So, in physiotherapy, what we do is we focus on management of pain, management of the posture, and regaining of the patient movement. For example, once the patient pain is reduced, we need to focus on the posture, because many a times if you do exercises but your posture is not correct, if you are sitting slouched again and again but you are doing exercises, that won't sustain the improvement in your condition. So we need to train and we need to focus on the posture, because 70% of the treatment plays a very important role of posture. And then at the end, we need to focus on regaining of the movement. Means if someone standing is affected, means he is having pain in the standing. So we need to test the particular muscle which are affected in those cases, and then according to that we need to train that muscle so that his standing should get better. About the pain management, then along with this we need to take care of the diet and nutrition also. Person
Right.
has to take his vitamin D and B12 level, because vitamin D is his bone health and B12 is the nerve health. So those two deficiencies may also affect your spine health. So you need to take care of that. Along with that, you need to avoid the anti-inflammatory foods. You should focus on eating more home cooked food instead of eating the sugary food or junk food. Then you should also, we also focus on mindfulness or meditation of the patient, because sometimes the stress and anxiety because of pain, patient comes into the depression. So we need to counsel that patient for the same. And then lastly, if by doing all these things even though patients are not getting better, then the last option is to have the injection based treatment, which are now blocks and steroid injection. So we ask them to refer to orthopedic doctor, they give them, and after that we again try the physiotherapy for a couple of weeks. And many of times patient get better with those after the nerve blocks and all. We can maximally, means 90% cases can be treated with a non-surgical way.
Great, because any surgery, the kind of impact it has on anybody's body is not good. And if there are alternative ways to go through a non-surgical intervention, and you said that even in a worst case scenario, some combination of some injections plus physiotherapy can also take care of a severe condition. And I'm sure there will be 10% cases which will require, surgical intervention. But that's great that 90 to 80 to 90% things can be managed.
Yes.
Now, going forward, we what are some of the, can you share some of the exercises or stretches that individuals can incorporate? And that's where even people who are working and sitting, and probably, on people who are doing different occupation as well. So what are these different exercises and stretches which we can do on a daily basis, focusing on our spinal health?
Correct. So for the back, I am sharing with you this video. In the first image, you can see I am doing the backward bends, which are very helpful for reducing the back pain. This exercise can be done from the age group of 18 to age group of 70. Depends on the patient problem, but anyone can do this exercise. That is very basic and simple exercise, which will help to reduce the back pain and improve the flexibility. This you can repeat 10 repetition 2 to 3 times in a day. uh, so that your pain will gradually get better. Uh, the second image or second video is about the stretch. So I'm keeping my hands on the wall and I'm leaning backward. So and I'm stretching my back muscle. So this will help you to reduce the tension on your back when you are working, especially on the laptop and sitting for long hours, so that we can reduce the tension on the back and you will feel relaxed, or your mobility will be maintained on
Right.
the daily basis.
Right. So I think these are wonderful. I think people can see it, and actually, it's like spending 10 to 15 minutes a day to take care of, something which is so important for our body, which is our spine. I think that's actually something which we all should be doing. Going forward, let's talk about some specific techniques or approaches within physiotherapy that are particularly effective for spinal care. So, are these exercises a part of that, or is there anything other than that also which you would like to share with us?
See, every patient is different. So, for every patient, the protocol will be different. But if the patient is coming in the acute condition, so we first start with the RISE therapy, that is rest, icing, compression, and elevation, wherein we focus on reducing the pain of the patient. And then once the patient pain is down, then we can focus on improving his strength. So we start with the core strengthening exercise. Gradually, we move on to improve his flexibility and mobility and the endurance. Once then other part is when the patient is having chronic problem, like someone who is having back pain, along with that he is having other complications, like he is having headache, or he is having osteoarthritis or rheumatoid arthritis. Then the protocol will be different for that patient. Then we have to there in that cases more muscle stiffness will be present, more joint restriction will be present. So we need to treat the patient according to the patient need. We need to focus on the reduction of the particular concern of the patient. So, like that, we need to set the protocols. So, specific techniques like when the patient comes to clinic, we for the pain management we use ultrasound, IFT, TENS, all these modalities. Where we also use the taping techniques to reduce the pain, swelling, inflammation. Then once the patient is slightly better, then we can move on to like TheraBand exercises, squeeze ball exercises, Pilates exercises, McKenzie exercises to improve his strength. Lastly, we need to gain his stability or stamina. So we focus on control movement. So for that, we use the kinetic control therapy, wherein we focus on controlling of the movement. That is very slow and specific exercise technique, which help the patient to, it helps in while sitting or standing to control the particular movement.
Right. So I think there's a combination of many techniques, and at the different intensity and different requirement, it is used as appropriate. Okay, so now moving forward, we often hear about the importance of maintaining good posture. So how is it in preventing and managing spinal problem? How important is our posture, and what is that you suggest? How can we improve our posture, especially while we are working on the laptop for 8 to 9 hours, and all the time we have to keep looking at the screen and bend our neck, and I think it has a huge impact on our spine. So what is that you suggest for that?
Yeah, definitely, I will suggest. So in this picture, can you see there are the different positions is given, and at each position you can see on your left side the disc pressure is given in the kgs. So when it comes to the maximum pressure on the disc is when you sit and when you bend forward and lift something. So that is 275 kg of the disc pressure is increasing. That means you are putting too much pressure on your disc. Okay.
Right.
In the next image, you can see when you lean forward and sitting and doing your work, the pressure on the disc is 185 kg. So can you imagine you're sitting for 8 to 9 hours and you're continuously in that position? So
Right.
how it is going to affect your disc? So to relieve this tension, what you can do is you can take frequent breaks in your posture. If if taking frequent breaks is not possible, you can just move your spine forward and come back, go forward and come back from the lower spine. You can do the neck stretches, like you can hold the chair with one hand and take the neck to the opposite side and hold that position for at least 10 seconds. You can repeat that same on the other side.
Mhm.
Okay. You can move the
Yes.
wrist clockwise and anti-clockwise 10 times. You can take your hand behind and you can stretch it behind so that it will stretch your upper body and lower back. Hold this position for 20 counts and relax. This you can repeat 2 times at least. Then you can take the hands like this, rotate your spine so that the tension of the spine will be reduced. You can move in this position at least for 5 repetition or 10 repetition, and this you can repeat 2 times in a day. Along with that, you can break your posture in between. As I said earlier, in 1 hour, at least get up at one position and then you can sit down. Otherwise, you can have take one round and again come back and sit, so that the pressure on your disc will be less and your flexibility or mobility will be maintained. How to maintain the good posture, or what are the importance of maintaining good posture. So if you maintain your good posture and sit in correct manner, so your blood circulation in your body is perfect, your digestion process will work perfectly, it improves your mood, it improves your confidence, it improves your form of exercise when you exercise, it improves your lung function capacity, heart capacity. You will be enthusiastic at the end of the day. You won't be tired, and next day you can work again more efficiently. Along with this, I also need to advise you, or I would like to share some tips with you to avoid, or you can keep your spine in a healthy way. First thing is, if you are a smoker, then stop smoking because it reduces the oxygen level at disc, and hence the desiccation of disc means disc का सूख जाना. ये problem जो होती है at the end of your life, or in my clinical practice I have seen the patient who are non-smoker, they are good disc, even though they are having back pain, but they have there is no desiccation of the disc, versus those who are a smoker, they have a desiccation of the disc. Okay. Second thing is, do check your vitamin D and B12 at least once in a year and take the appropriate vitamins level. Third thing, drink plenty of water, at least 3 to 4 liters per day. Post your workout, please do stretching so that you can pull down your muscles and avoid junk or anti-inflammatory.
So I think a lot of tips for us to take away, and absolutely given in, the right way in terms of the posture. And it is quite interesting to know that even while we are sitting on our chair, हम लोग बोलते हैं 10 घंटे हम लोग ऑफिस में होते हैं, कहाँ कर सकते हैं. So it is very interesting that while sitting on our chair also we can spend 5 to 10 minutes, and I think it is much needed. Even now I keep sitting on the chair for the whole day, and by the end of the day we can feel quite a lot of strain on our back as well. So I think these things are very useful, and I think we all should kind of follow them. So I think before we end the podcast, would just like to know one real case study of yours, a patient who was kind of suffering through a spinal issue, and how physiotherapy and a great combination of techniques that you use. It's not just one specific thing, but a good combination of different techniques and diet and nutrition. So all of that, how can you share one case study with us where we can understand that how it actually helped?
Yes, sure. So this person in first video, you can see he is unable to get up from his bed and he's not able to move around. So, for this patient, the pain is started because of he fall down from a height, and low back pain was radiating down to his leg,
Mhm.
wherein he is having tingling and weakness in the leg, due to which he cannot able to walk. So in the second video, you can see after 2 months of physiotherapy treatment, he can easily able to move on the road. So during his treatment, we focus on first to reduction of the pain, for which I use the different modalities, McKenzie exercises, and then secondly, once his pain is less, we focus on the strengthening of his spinal muscle, like core muscle, back muscle, upper back muscles, and leg muscles, due to which gradually he got better, and now he is completely fine.
Other one you want to share, or this was the, so I think this is actually seeing is believing. तो जैसे आपने दिखाया कि from immobility to recovering within 2 months, I think that's a great achievement. So any other case study you would like to share before we end? Yeah.
Yes. So in this first video, you can see this female, that is, she is a 26-year-old IT profession working woman. She had gone to some treks, and after she had gone to some treks, and after the trekking, she has suddenly developed a weakness in her back. So she's unable to walk also properly. She's limping on one side, and after physiotherapy for about say 15 days to 20 days, she's completely better. So in after 5 days of therapy, in second video you can see her walking is got better. In lying down position also, she is able to lift her other leg, but she is not able to lift the affected leg. But after few visits, she can able to lift the affected leg also. So gradually, you can see a changes in yourself. It's just that physiotherapy works slow, but it helps to solve your problem from the root cause.
That's the whole objective of all the therapies that we have on Nature Fit. The whole platform is kind of getting all the therapies which work on the root cause, rather than just symptomatic. So that's something which we, it's like you spend some time now and get yourself permanently cured, or you will be on medications all your life. So, the choice is with the patients, with the users, because they all feel that all of these therapies take time, but they take time, but they will heal you for, ever. So, and they will teach you changes in your lifestyle, which you have to imbibe, to remain healthy. I think that's the most important part of, physiotherapy or any of these therapies that we are promoting on Nature Fit. So thank you so much, ma'am. Thank you for joining today with us. And anybody who wishes to consult, they can consult with her. In the description, we have given the profile link. You can get all her details, all her services. Everything is mentioned in the profile link, and you can directly book an appointment on the on the app or on the website and connect with Dr. Smita. Thank you so much, ma'am, and thank you for joining. Thank you for sharing so many things which we came to know about the miracles of physiotherapy. And thank you for the users for viewing this session. And next week, we will again be back with another doctor, another health problem. But the common thing is we would like to heal from the root cause in a natural way, and that's what we stand for. Thank you so much. Thank you for joining, ma'am.
Thank you so much, ma'am.
Yeah.